Hi guys, this is Sharmee Divan here and welcome to today's video. All this while we have been talking about anxiety. If you haven't watched my anxiety videos on the Help Talk library, there were other videos that I had shot and we had discussed some tools to safely cope with anxiety. And today I'm again back with a series of videos where I'm going to share some more tools of coping with anxiety. So if you haven't watched those videos, please go ahead and watch them before you continue with this series, so that everything kind of will link in together. So today I'm going to be talking about EFT tapping. Now, this is a topic that has been talked very much so on the Health Library, but I wanted to bring in my perspective, my understanding of how to work with EFT tapping and anxiety. And as per scientific research, compared to even CBT, which is cognitive behavioral therapy, EFT tapping works even better than a psychological theory that has been researched on for so many years. So, if you want quicker, more efficient results and more permanent results, to heal from the anxiety, and I always say the anxiety, I never say my anxiety, I never say your anxiety, because it's important to not own a problem, a disease. And I have a video where I have talked about how important it is for us to, acknowledge that we have it, but it is also important for us to then go ahead and return it to the sender. So definitely make sure to watch that video and then come back in over here. So when we talk about EFT tapping, why does it work? Let me share that very quickly. So EFT tapping points. Now, the tapping that we do is extremely gentle. It's not like you are going around slapping your hand like this. It's a very gentle tap, right? Number one, it is a tap. Number two, what I feel is that people who are anxious, and I have worked with a lot of clients who have anxiety as a label or who have daily anxieties. And what I have observed is that they really like the feel of a rhythm, okay, in their lives. They really enjoy rhythm. When I say rhythm, it could be like, moving back and forth or moving side to side, or like, tapping hands like this. And let me tell you, this is a mudra. I am a mudra therapist, and that's why I think that if you do some EFT tapping with me, that it will be even more beneficial for you. So when we work with people who have anxiety, I teach them a combination of different things. So this is step one. I had also showed you the Jinshin Jitsu holds, where you do the finger holds and do the breath work, and that video is also there on Help Library. So definitely go and watch that as well. This is the carry forward from there. Okay, so when we do EFT tapping, we all know the points, but let us go ahead and revise these points. Okay, because different practitioners have it differently somehow. Okay, slight variation, not too much. They are still the same points. Maybe the sequence is a little bit different, or maybe the style is a little bit different. So we start with what is known as the karate chop. Now, if you think about the karate chop, like, when people go, hi-ya, and then they break um, the wooden plank or the brick, or, something, and to show that it can be done with a technique. So this is a pattern breaking or a habit breaking point of EFT, which is known as the karate chop. And very gently is how you would tap on the karate chop, like this. And from here, you come to your face. So karate chop, From there, the inside of the eyebrow, then to the outside of the eyebrow, and then under the eye, and then under the nose, and from there at your chin, from your chin to your collarbone. Mine is not very significantly showing, but anywhere on your collarbone is fine. So I usually tap here. And from here, we come to our hand. And it doesn't matter which hand you choose, totally your choice, to the outside of your thumb, right? Right here. Then your first finger, the middle finger. With the ring finger, you don't do it on this. You do it on this side. If you are pregnant, trying for a pregnancy, etc., avoid this finger completely. It's okay to avoid this finger, okay? But if you want to tap on this finger, you want to do it on this side. So all the others we have done on the outside. So here, then here, then here. This one you do it on the inside, okay? And then again for your little finger over here. And that brings us back to the karate chop. Okay? So let's do this together. Okay, I hope that your hands are washed and sanitized and it's safe for you to touch your face, to touch your own self on these points. So let's do this together. Go ahead, take a deep breath in, let it out. And we're just doing the points to get acquainted with them, with me. I know you have done this with other trainers, but this is me. So we're going to practice it first and then we're going to put in the words, okay? So karate chop. And I will keep guiding you. Karate chop. Inside of the eyebrow. Outside of the eyebrow. Underneath the eye. Under your nose. On your chin. The collarbone. I did forget to show you one more point, which is under the armpit. So you lift your arm, and for women, it's really easy. It's where your bra strap comes. For men, like, you know, if somebody was to like jab two fingers right here at your ribs, that's the point, okay? So under the arms. Now, some people do this, and that's completely okay. Or you could do this, okay? And then coming to your hands. 1, 2, 3. If you choose the ring finger, please make sure that you're not pregnant or trying to conceive. And on the inside of the ring finger, not this side, but this side. And the little finger. Okay. Are you with me on this so far? Okay. Now let's put words in position. So what I want you to do is I want you to give your anxiety that you have a number, the anxiety that you have a number from 1 to 10, where 1 is it's hardly even there, you don't even notice it, and 10 is, oh my god, I'm going crazy, this anxiety is driving me nuts and I could really do with some help. Okay, so if you are anything under a 3, you're okay, you can just do this for fun. Okay, just for your knowledge. If you are over a 3, let us begin tapping. And I want to also bring this up, that this is a generic tapping that I'm doing. As an EFT practitioner, I would want to see a client personally to be able to customize a tapping session for them. But this, even if you do on a generalized manner, it will bring the anxiety down. Okay, so let's begin. And speak with me, speak as I speak. Okay, and see if you can do this out loud, because if you do it out loud, it is just that much more effective, because you're doing twice the listening. You are listening with your ears, and then you're listening to yourself on the inside as well. So it's twice the work that you're doing in one go. All right, so let's begin. Even though I have this anxiety, and it is on a number, and whatever your number is, plug that in. So let's say it's on a number 6. I still choose to love and accept myself. Let's say that again. Even though I have this anxiety, and it is on a number, I still choose to love and accept myself totally and completely. One more time. Even though I have this anxiety, I still choose to love and accept myself totally and completely. And from here, come to the face. This anxiety, it is on a number, whatever your number is, and it makes me feel, however that it makes you feel, I have this anxiety. This anxiety that is on a number, and it is making me feel. And when I feel this way, what I'm really feeling is I have this anxiety, and it is on a number, making me feel, making me really feel. Avoid if pregnant, but I still choose to love and accept myself totally and completely, just the way I am. This anxiety on a number, making me feel, and that makes me think, and keep filling in the blanks. Okay guys, I'm just giving you generic statements. So it makes me overthink, it makes me underperform. This anxiety making me anxious, making me uncomfortable, making me sleepless, whatever your physical and emotional symptoms are, just keep filling the blanks as we continue to tap, okay? This anxiety. Oh my gosh, this anxiety. My gosh, this anxiety. Oh, this anxiety. Ooh, this anxiety. And it is making me feel. And maybe it's mine. Or maybe it isn't mine. Maybe it isn't mine. Or maybe it is mine. But I have this anxiety. And it is on a number, making me feel. But I still choose to love and accept myself just the way I am. And now go ahead and put your hands on your heart and breathe along with me. Take a deep breath in through the nose, out through the mouth. Another deep breath in through the nose. And out through the mouth. And one last time. And gently open your eyes. And once again, give yourself a reality check. What number has this anxiety reached on? Maybe it started at a 6 or a 7 and it reached, let's say from a 6, it went to a 5 3/4. That is still improvement, okay? Any improvement is good improvement. And of course, there is a personalized way to approach this, to work with this. And there are therapists, including myself, all over the world who will do EFT tapping sessions with you. So if you have found this beneficial, go ahead and share these EFT points with your friends, your loved ones, and start to practice this yourself. Inculcate it in your day-to-day life, and you will start to see the change. Okay, so you be this change that you want to see in yourself, in others, and then automatically people will get inspired. All right. Okay, so this is Sharmee Divan saying thank you very much for watching this video till the end, and I will see you in the next one. Until then, take very good care of yourself. Namaste.
Help Talks are daily health-related talks held at Health Education Library for People, Mumbai, India. For more information visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.